What's up, beautiful people? Another day, another study. We've previously covered different modalities for osteoarthritis here, and very much needed because therapies like NSAIDs and opioids have a whole bunch of problems, and people get admitted to the hospital for complications for those all the time. Even with surgery, about 30% of people aren't happy with their outcomes for knee replacement. So this study was looking at PEMF and PRP, and then looking at the combination of them together and saying, can it improve various things with osteoarthritis? They were looking at two different questionnaires, a visual analog scale, which is like that 1 to 10 scale with different faces about pain, and then also looking at knee mobility. And they found that compared to baseline, all three of those modalities improved the testing that they were doing. However, they found that the PEMF and the PRP combination together was better. Now, this used a leukocyte-poor PRP because they thought if white blood cells were in there, it might worsen inflammation. And this is kind of conflicting in the research. So some studies show benefit with these types of things with arthritis and pain. I'm talking about PEMF and PRP. Others do not. It's likely we haven't found the right dosing or combination or protocols. They're all a little bit different in these studies. Have you tried PRP or PEMF? Let us know down below.